If you have a mental health condition, how do you know if you should see a psychiatrist or a therapist? That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. This topic is based on a viewer question from JB. JB says,
Dr. Marks, I've been feeling depressed for months and can't shake it. I thought it would go away as it has in the past, but this time it's starting to affect my work. I know I need to see a professional, but I don't know who I should see. Should I look for a psychiatrist or a therapist?
thank you, JB, for your question. I'm going to answer this question in general terms because ultimately the decision depends on how severe your symptoms are and what you're looking to get out of treatment. For starters, though, technically speaking, psychiatrists are therapists who can also prescribe medication. Psychiatrists are physicians who specialize in the area of medicine that deals with the mind and brain. Brain and body science takes into account how your physical condition affects your brain, and the science of the mind involves understanding how what you think affects your behavior and how you respond to forces in your environment. Aside from the training that we get in medical specialties like internal medicine and neurology, psychiatry training includes learning a few therapy modalities like psychodynamic therapy, which some people call insight-oriented psychotherapy, cognitive behavior therapy, and supportive therapy. These are only a few of the many psychotherapies that are available, but many psychiatrists don't practice psychotherapy and limit their practices to medication management of the psychiatric disorders. This is especially the case in large insurance-based practices. Many insurance companies don't pay very much for psychotherapy, so practice managers will limit the psychiatrist's work to medication appointments and have the therapist do the therapy. But that's a choice that the psychiatrist makes to work in that kind of practice. It's not because they don't know how to do therapy. Therapist is a broad term that includes a variety of professionals such as psychologists, social workers, licensed professional counselors, and marriage and family therapists. They provide psychotherapy or talk therapy and cannot prescribe medication, although there are some states that allow psychologists to prescribe medication with additional training. Therapists use psychotherapy to help you reduce symptoms, identify negative thought patterns, change behaviors, improve coping skills, be more self-aware, and navigate relationship problems. There are many different types of therapies out there. Some of the major ones are cognitive behavior therapy, dialectical behavior therapy, acceptance and commitment therapy, psychodynamic therapy, interpersonal therapy, problem-focused therapy, schema therapy. Then there are the trauma therapies like EMDR, which stands for eye movement desensitization and reprocessing, prolonged exposure therapy, somatic therapy, and inner child work. And this is just a short list. It didn't seem short, but it really is short compared to all the therapies that are out there. And there are too many therapies for one person to be skilled at all of them. What usually happens is a therapist will graduate from their program with training in a few core therapies, then get additional training in non-core therapies that interest them, and then focus on those therapies in their practice. Now, getting back to the issue of whether you should see a psychiatrist first or a therapist. Reasons to see a psychiatrist are if you're open to taking medication and you want to know if you need them, if you have moderate to severe symptoms that interfere with your daily functioning. What would that look like? These would be things like having trouble getting out of bed, such that you're missing work or school, you're letting your hygiene slip, maybe you're not eating much, or you're drowning in helplessness and can't see a way out of how you feel. If you have any degree of psychosis that includes delusions or hallucinations, you need to see a psychiatrist because psychosis is an indication of severe symptoms that are not going to be talked away with therapy. Another reason to see a psychiatrist is if you have a complicated set of symptoms or other medical conditions that may affect your mental condition. The psychiatrist's medical approach may be needed to sort out what's what. The psychiatrist may determine that you have a condition that can respond to therapy with or without medication. For example, CBT and IPT, which stands for interpersonal therapy, are first-line treatments for depression. First line means the therapy can be used as the only treatment without medication. So a psychiatrist could inform you of the therapy options and maybe even refer you, or at least let you know what's out there. Most people don't know from the outset what kind of therapy that they should be looking for. Some conditions need medication management, like schizophrenia and bipolar disorder. Severe anxiety may not respond enough to therapy alone and may need medication. ADHD, or attention deficit hyperactivity disorder, is a disorder that may or may not require medication. There are executive function coaches that can help with things like time management, planning, emotion regulation, impulse control, and working memory. These are functions that are only marginally improved with stimulant medication. If your ADHD is mostly trouble with focus and concentration, and executive dysfunction is not that impairing for you, then you may do well seeing a psychiatrist or pediatrician, if you're a child, for medication to treat the focus and the concentration. But if you don't do well with stimulants, and many people don't, they get depressed or they feel like they lose their personality, then skills training may be the way to go for you. It's not that easy to find an executive function therapist because it's pretty niche, and some of the practitioners may be trained as coaches and not therapists. So those are the reasons to see a psychiatrist. When should you skip the psychiatrist and see a therapist first? If you want help with things like your relationship, understanding yourself, or especially if you need trauma therapy, these would be reasons to see a therapist. Unless the psychiatrist markets themselves as a trauma specialist, it's unlikely that they do trauma treatments. Not every therapist does trauma therapy, and if you need help healing from wounds of past trauma, you should seek out someone who says that they have a special focus on trauma. Medication treatment and psychotherapy are not mutually exclusive. Many people have split treatment where the psychiatrist handles the medication and the therapist does the therapy. And this would be the case if the psychiatrist doesn't do any therapy or doesn't do the kind of therapy you need. Also, you don't have to worry about getting it right the first time. If you go to see a therapist and the therapist thinks your symptoms are too severe for therapy alone, they will recommend you see a psychiatrist. For more on severe depression, watch this video on psychotic depression. Thanks for watching. See you next time.